death. Health officials have reported a flu death in Lancaster County. Channel 8 Eyewitness News reporter Katrina Spurl has the very latest details in our top story tonight. Katrina?
Megan, along with that sad update, local parents are worried about their kids going back to school next week with the flu activity so high. Health officials in Lancaster County say the flu numbers are still very high. One death has been reported, an adult over 60 years old. Both influenza A and B viruses are circulating locally.
Stay home. Don't go to school, go to work. You're just spreading it to other individuals.
Lincoln Public Schools are back in session from winter break on Tuesday. It has a parent worried about sending her kids because one of them just got over the flu.
Well, even with the flu shot, there was a case of somebody dying over the holiday break. So, there's so many strains of just germs and stuff out there right now. Everybody's got to do their part to help all of our kids stay well.
Just before winter break at LPS, Tim says flu activity was starting to increase. He suspects when school begins, they will see it again.
It's so widespread in the community. In fact, about 22% of the cases that we've had so far have been in school-age children, individuals 6 years to 19 years of age.
If a large group of kids were to be impacted, it would be up to the school on whether or not they should stay open. LPS tells us they would follow what the health department recommends.
I think if the flu numbers are too high in a certain school, my hope would be that they would let parents know that there's a huge number of kids that have been called in sick. Then parents can determine if they want to send their child or not. You're going to get exposed to germs anywhere you go where there are people.
Flu symptoms tend to come very suddenly. You feel fatigue, achy, feverish, and usually a cough or maybe a sore throat. Health officials can't encourage the public enough to get the primary means of prevention, the flu shot. The Lancaster County weekly influenza positivity rate increased to 28.2%. Provider visits and hospitalizations for flu also increased significantly.